Here to discuss, Newsmax insider and America's Voice news contributor Tom Borelli and president of the Center for Medicine in the Public Interest, Peter Pitts. Good to see both of you this Monday morning. Peter, we'll start with you. As we're seeing the number of cases begin to plateau or decrease in some parts of the country, we of course have to contribute some of that to social distancing. So, what do you make of Dr. Birx's statement? Is she, unfortunately correct in the fact that social distancing appears to be the new norm?
I think that she's exactly right. What we've been able to accomplish in minus a vaccine is to beat COVID-19 into the ground by being smart and taking personal responsibility. I think beyond social distancing, masks are also here to stay. And also, and this is good news, a continued focus on personal hygiene. These are all important things. So I think when you think about social distancing, personal hygiene, masks, being smart, it comes down to taking personal responsibility, short of a vaccine, for helping us get back to the near new normal.
Right. A lot of things that we're going to have to take into our own account. We're going to have to make some changes. But Tom, I want to bring you in here. Businesses are also going to have to make some changes as well if they hope to reopen in the near future.
No, absolutely. And I think we have to be careful with the words we're using, definition. Social distancing does not mean quarantine. I think the most important aspect of this is we're now finding out the mortality rate of the coronavirus is far less than what we thought. Remember, the whole idea of flattening the curve was to lower the infection rate so that hospitals would be able to deal with possibly a surge of cases. We've been able to do that. Now it's time to slowly and smartly open up the economy. A one-size-fits-all policy does not fit. Not every county in the United States is New York City. Those nuances, the differences county by county, need to be reflected. The policy must reflect the data, and there's some encouraging data. We need to get the economy going before the cure is worse than the disease itself.
Well, as you mentioned, it is definitely a county by county issue. I don't think anyone's arguing with that. We see the numbers in New York and New York City specifically being so much higher here. But Peter, the concern, of course, is potentially overwhelming the healthcare system, as Tom just mentioned. Are hospitals across the country ready for people to reopen business and to potentially take on additional patients?
It's going to be different strokes for different folks. In New York, we prepared for the worst and we didn't see it. That's good news. Places that are COVID-19 light right now will certainly see a surge and are certainly in the front lines for the second wave. But not only are we talking about where things will open and what type of businesses will open, we also need to talk about what type of people can go back to work and resume normal activities earlier. Clearly, we want the higher risk population, the older population, the population with pre-existing healthcare conditions to be extra cautious and perhaps not to go back to work. So again, it's going to be cut and dice in a number of different ways. We have to be very smart, very strategic, and extremely tactical.
All right, this is another interesting thing to share. Real Clear Politics reported that doctors across a number of urgent care facilities conducted more than 5,000 COVID-19 tests, coming to the conclusion that it's very similar to the flu and quarantines are not making any difference in preventing its spread. Again, that's from Real Clear Politics. Now, we do know, of course, that there's no vaccine, unlike the flu, so it is different and potentially more fatal, of course, as we're seeing, but maybe not as fatal as we previously predicted. Tom, what's your reaction to this survey?
Well, as we're discussing, I think the mortality rate, which is really good news, isn't what we originally feared when we were watching Italy, what was going on there. But I want to pick up on Peter's point. The most important thing, I think, with the data that the policy needs to reflect is the fact that the older Americans and those with pre-existing conditions are at most risk. In New York State, 38% of the fatalities are from New Yorkers who were 80 and above. 27% were from age groups from 70 to 79. So clearly it's the older Americans, those with pre-existing conditions need to be quarantined. And I think the better policy is now to let the younger, healthier people get back to work. I think that's the right balance.
Interesting that we're discussing not a matter of when to get back to work, but specifically who to get back to work as well. Good to speak with both of you guys. Newsmax insider and America's Voice news contributor Tom Borelli and president for the Center for Medicine in the Public Interest, Peter Pitts. Thank you both so much.